The people. The people are the best part about this program.
I think it's the community of not only residents, but also faculty.
And everybody here, they're real. Beyond just radiology and medicine, they talk to you and care about your personal lives. They want to know how your family's doing. They want to know what you're doing this weekend. They expect that we're going to have lives outside of just medicine and radiology.
You'll run into them at the grocery store or when you're out and about, and they really take an interest in your life outside of work as well. They ask you how your weekend was and what you did, and the attendings become more than just a teacher, but they also become a friend.
When I was interviewing here, the one thing that really stood out to me was the good balance between female and male attendings. And I also noticed there is a big female presence within the department. Dr. Chertoff is the chair of our department, and she's also known nationally. She recently won the Outstanding Educator of the Year last year at RSNA. We also have Dr. Lewis, who is also known nationally. She is our Director of Education, and she is great at interactive teaching, and she makes a ton of YouTube videos that people all over the US watch. She is basically the backbone of our program. She's extremely supportive of us. She's our advocate all the time. She's constantly answering emails to us in the wee hours of the night. She's always there for us. And throughout the years, it's always been easy to kind of go to her and other committees that are available to talk about how we want to improve the program. And each year I have noticed there's been significant changes in the program based on our feedback. And so this program is very open to change.
So I think they do a really good job here with emphasizing putting education at the forefront of what the goal of the program is. That was something that kind of was apparent to me during my interview here, was how committed they are to the education of the residents and the med students, the fellows as well. It's not just about cranking out volume and those kind of things. It really is about learning. Our attendings are very thorough with us when they teach us. They always are. Nobody's ever too busy to teach is one of the things that I think is a good way to describe the atmosphere here. Something that I see that I think really reflects again how much emphasis there is on teaching here, and that is how the medical students rotation that they do in our department is somewhat rigorous. They're contributing, they're helping us look up things about patients, they're getting opportunities to be the first ones to look at studies themselves and put a sample dictation in. And I think when you go through that level of making sure everybody involved is learning, I think it speaks volumes to what we're all about here.
The program really takes care of its residents here. If we get an abstract accepted to a conference, they'll pay for our flight out to the city, the hotel, and even food for the day.
We also go to AARP in Washington, D.C. for an entire month, and they cover your housing and your food during the entire time. We get the opportunity to go to Boston Children's Hospital for 3 months, and they provide this great apartment right near the hospital, free parking, and so you don't have to worry about all these extra expenses when you're in residency, because they will cover all of that for you.
We get a $500 book fund, which they encourage us to use every year. They also pay for your annual ABR dues, which are around $650 a year. They'll pay for a physics review course for preparing for the core exam. And they also provide us with a physics course starting in first year, so we don't get into the situation where it's third year and we have very little physics knowledge before taking the boards.
The department puts us up in an apartment, right? It's right next to the hospital. but it's actually a really great area. You're not too far from Fenway Park. There's a lot of things to do in the area that are just a short walk, a lot of different restaurants and bars, and just explore the city, whether it's walk around, visiting some of the sites. Really gives you a good opportunity, and it's a nice location that they have us that's very central, that obviously we all drive our car down there and get a parking spot in the garage, but you don't really need a car once you're there, because you can kind of go anywhere from where we are at.
For your 4th year, you will be able to do electives. You'll get a total of 3 months to choose whatever you want to do, which means you can do an extra month of MSK if you want to, or you can we have collaboration with surgery. So in terms of mammo and ortho, you can actually rotate with them and see what they do in the OR and kind of collaborate them with the imaging. So I think that's a pretty unique opportunity. Another great thing is that we also travel internationally to Tanzania. Dr. Rooney has a great relationship with them, and we travel there and work with their team to kind of improve their systems. So that's another elective. And then another one a lot of people do is try to get an idea of what private practice is like. We have about an hour away, we collaborate with one of the small practices there, and you rotate there and get a feel of the number of studies to do every day and the variety that you would see in private practice. It's nice to know that after intern year, you won't have to take roll call for an entire year, so that's the best part about radiology. You will start formal call your 2nd year, and to prepare you for that, we have you take buddy call, but I like to call it baby call. So you are paired up with a senior resident starting in about February, where you take different shifts throughout the last few months of your 1st year, and you kind of get the feel of what it's like to be on call. You understand the protocols of when different situations arise, and then if you feel like you're weak in a certain area, that's the time when you can kind of brush up in that particular subject.
A big thing that attracted me to Dartmouth was the fact that it's a resident-run program, and while there are fellows, and the fellows get good training, there is never a shortage of procedures. And I remember at the interview dinner talking with one of the residents who was telling me he was a 1st year and he's already done over 50 lumbar punctures. And I remember saying that this is a place I want to be. This is a place where the residents will come first, and they will get first crack at a lot of these procedures. And now that I'm a 3rd year, I can say that that's 100% true.